Hydrocephalus is a complex neurological condition that affects the brain and its surrounding structures. At its core, hydrocephalus involves an abnormal buildup of cerebrospinal fluid, or CSF, within the ventricles or cavities of the brain. This excess fluid puts pressure on the brain tissue, potentially causing a range of symptoms and complications. To understand hydrocephalus better, let's first talk about cerebrospinal fluid. CSF is a clear, colorless liquid that surrounds the brain and spinal cord. It acts as a cushion, protecting these delicate structures from injury. CSF also delivers nutrients to the brain and removes waste products. In a healthy brain, CSF is produced, circulates, and is absorbed in a balanced cycle. However, in hydrocephalus, this balance is disrupted. What's interesting here is that this condition is sometimes referred to as water on the brain, but this term can be misleading since the fluid involved is cerebrospinal fluid, not water. Hydrocephalus can occur at any age, from infants to older adults. It's not an extremely common condition, but it's not rare either. In the United States, hydrocephalus affects about 1 in every 500 to 1,000 babies born. For adults, the exact prevalence is harder to determine, but it's estimated that about 700,000 adults in the U.S. have hydrocephalus. Causes of hydrocephalus. There are several reasons why someone might develop this condition. In some cases, it's present at birth, called congenital hydrocephalus, while in others, it develops later in life, which is called acquired hydrocephalus. The most common cause of congenital hydrocephalus is a condition called aqueductal stenosis. This occurs when the narrow passageway connecting the third and fourth ventricles in the brain, known as the cerebral aqueduct, becomes blocked. When this happens, cerebrospinal fluid cannot flow properly between the ventricles, leading to a buildup of fluid and pressure. Aqueductal stenosis can be caused by genetic factors or by developmental problems that arise during pregnancy. Another cause of congenital hydrocephalus is neural tube defects, such as spina bifida. Spina bifida is a condition in which the spine and spinal cord do not develop properly, often leading to a buildup of cerebrospinal fluid in the brain. Acquired hydrocephalus, on the other hand, which develops after birth, can result from a variety of factors. One common cause is a brain injury, such as a traumatic head injury or a stroke. These events can disrupt the normal production, flow, or absorption of cerebrospinal fluid, leading to an accumulation of fluid in the brain. Infections, such as meningitis or encephalitis, can also cause inflammation that obstructs the flow of cerebrospinal fluid, resulting in hydrocephalus. Brain tumors, cysts, or other growths can also physically block the ventricles or the pathways through which cerebrospinal fluid flows, leading to increased pressure and fluid buildup. Sometimes, bleeding in the brain, known as intracranial hemorrhage, can lead to hydrocephalus by blocking the normal flow of cerebrospinal fluid or by damaging the brain's ability to absorb the fluid. In some cases, particularly in older adults, hydrocephalus can develop without a clear cause. This is known as normal pressure hydrocephalus. While the exact mechanism isn't fully understood, it's thought to be related to problems with CSF absorption. Symptoms of hydrocephalus. The symptoms of hydrocephalus can vary widely depending on the age of the person affected and the underlying cause. In infants, the most noticeable sign is often an unusually large head. This happens because the skull bones haven't fully fused yet, allowing the head to expand as CSF builds up. Another symptom is a bulging fontanelle, which is the soft spot on top of the head. Other symptoms in babies might include vomiting, sleepiness, irritability, seizures, and eyes that appear to always look downward. In older children and adults, the symptoms can be more subtle and develop over time. Common signs include headaches, which might be worse in the morning or when changing positions. Nausea and vomiting are also frequent complaints. People with hydrocephalus often experience problems with balance and coordination. They might feel unsteady on their feet or have difficulty walking. Cognitive changes are another significant aspect of hydrocephalus. People might have trouble concentrating, experience memory problems, or feel generally confused. In some cases, there can be changes in personality or behavior. Vision problems are also common, including double vision or difficulty looking upward. For those with normal pressure hydrocephalus, a classic set of symptoms is often described, which include gait disturbance, like a shuffling or magnetic walk, urinary incontinence, and cognitive decline. These symptoms can sometimes be mistaken for other conditions common in older adults, like Alzheimer's disease or Parkinson's disease. It's important to note that the experience of these symptoms can vary greatly from person to person. Some might find the headaches to be the most bothersome aspect, describing them as a constant pressure or ache. Others might be more troubled by the cognitive changes, feeling like they're in a mental fog or struggling to keep up with conversations or tasks they used to find easy. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of hydrocephalus. Diagnosing hydrocephalus involves a combination of clinical evaluation and imaging studies. When a doctor suspects hydrocephalus, they'll start with a thorough medical history and physical examination. They'll ask about symptoms, when they started, and how they've progressed. In infants, they'll measure head circumference and look for signs of increased intracranial pressure. Imaging tests play a crucial role in diagnosing hydrocephalus. The most common and useful test is magnetic resonance imaging, MRI. An MRI can provide detailed images of the brain, showing the size of the ventricles and any potential obstructions in CSF flow. Computed tomography scans can also be used, especially in emergency situations, as they're quicker to perform than MRIs. In some cases, doctors might use specialized tests to evaluate CSF flow and pressure. A lumbar puncture, also called a spinal tap, can measure CSF pressure and allow for analysis of the fluid. For suspected normal pressure hydrocephalus, doctors might perform a large volume spinal tap, removing a significant amount of CSF to see if symptoms improve temporarily. Treatment for hydrocephalus. The treatment typically focuses on reducing the buildup of CSF and relieving pressure on the brain. The most common treatment is the surgical insertion of a shunt system. A shunt is a flexible tube that's placed in the brain to divert excess CSF to another part of the body where it can be absorbed. The shunt system consists of three parts: the ventricular catheter, which goes into the brain, a valve, which regulates the flow of CSF, and a distal catheter, which carries the CSF to another part of the body, usually the abdominal cavity. After insertion, the shunt allows CSF to flow out of the brain at a controlled rate, maintaining a healthy balance. While shunts are effective, they're not without complications. They can become blocked, infected, or malfunction over time. Many people with shunts will need revisions or replacements at some point in their lives. This means ongoing monitoring is crucial for anyone with a shunt. In some cases, particularly for obstructive hydrocephalus, a procedure called endoscopic third ventriculostomy might be an option. In this minimally invasive surgery, a small hole is made in the floor of the third ventricle, creating a new pathway for CSF to flow. This can bypass the obstruction and restore normal CSF circulation without the need for a shunt. For normal pressure hydrocephalus, treatment can be more challenging. Some people respond well to shunt placement, experiencing significant improvement in their symptoms. However, not everyone benefits from this treatment. Doctors often use temporary drainage of CSF through a lumbar drain to predict who might respond well to a permanent shunt. At the end, living with hydrocephalus can be challenging, but many people lead full and productive lives with proper treatment and management. Regular follow-ups with a neurosurgeon or neurologist are essential to monitor for any changes or complications. Now, we want to hear from you. Do you or someone you know have hydrocephalus? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.